Ever wonder what happened when you got sick in the Middle Ages? Ready to be horrified by what passed for healthcare before modern medicine? The medieval period wasn't exactly known for its advanced medical knowledge, and the cures people came up with were often worse than the diseases they were meant to treat. Number 11. Trepanation. Drilling holes in your skull. Did you know medieval doctors would drill holes into people's skulls to cure headaches, epilepsy, and mental disorders? This procedure, called trepanation, involved cutting a circular hole into the skull using special drilling tools. The idea behind this gruesome practice was to release evil spirits or pressure that medieval physicians believed caused these ailments. Imagine waking up with a migraine only to have someone suggest they need to put a hole in your head to fix it. The practice dates back thousands of years, with evidence of trepanation found in prehistoric skulls. By the medieval period, it had become a somewhat refined procedure, complete with specialized tools and techniques. The truly shocking part. Some patients actually survived this procedure. Archaeological evidence shows healed bone growth around trepanation sites, indicating patients lived for years afterward. How they managed to survive having holes drilled into their skulls without modern antiseptics, anesthesia, or antibiotics remains astonishing. Medieval surgeons would prepare the patient by shaving their head and sometimes giving them alcohol or opium for pain relief. Then they would use a tool called a trephine, a circular saw with a center pin that helped keep it steady while cutting. The surgeon would carefully remove a circular piece of bone, sometimes keeping it for later reattachment, though more often not. The procedure was performed while the patient was fully conscious, with assistants holding them down. The pain must have been unbearable, and the risk of infection astronomical. Still, trepanation continued to be practiced well into the Renaissance. Number 10. Bloodletting, bleeding away your illness. Have a fever, suffering from inflammation, experiencing just about any ailment. In medieval times, the answer was often to drain your blood. Bloodletting was one of the most common medical procedures performed throughout the Middle Ages, based on the ancient belief in the four humors: blood, phlegm, black bile, and yellow bile. When these humors were imbalanced, illness resulted. Blood, being the most abundant humor, was typically the one doctors targeted for rebalance. The procedure took various forms. The most common method involved opening a vein typically in the arm and allowing blood to drain into a bowl until the physician deemed enough had been removed. Another popular technique involved applying leeches to the skin, which would suck blood until they became engorged and fell off. Special cups could also be heated and placed on the skin, creating a vacuum that drew blood to the surface, where small incisions would be made. The amount of blood removed during a typical bloodletting session was staggering by modern standards, anywhere from a few ounces to several pints. For context, the human body contains about 10 pints of blood total, and losing more than 40% can be fatal. No wonder many patients grew weaker rather than stronger after treatment. The practice became so routine that barber surgeons who performed bloodletting along with haircuts advertised their services with red and white striped poles, the red representing blood, the white representing bandages. Bloodletting reached its peak of popularity during the medieval period but continued well into the 19th century. Even George Washington is believed to have died partly due to excessive bloodletting. Doctors removed nearly half his blood volume while treating him for a throat infection. The practice gradually fell out of favor as medical science advanced, but not before countless patients were weakened or killed by this cure. Number 9. Mercury treatments, poisoning yourself to health. Would you rub poison all over your body to cure a disease? Medieval physicians regularly prescribed mercury, now known to be a deadly neurotoxin, as a treatment for everything from syphilis to parasites. The silvery liquid metal was applied to the skin, consumed orally, or even injected directly into the body. While it might have occasionally killed off some pathogens, it was simultaneously poisoning the patient. Mercury treatments became particularly common after the spread of syphilis throughout Europe in the late 15th century. The painful and disfiguring sexually transmitted disease had no effective cure until the development of antibiotics in the 20th century. Desperate physicians turned to mercury, which was administered in various forms. Mercury ointments would be rubbed onto syphilitic sores or all over the body. Mercury vapors would be created by heating the element, and patients would then sit in a vapor bath, inhaling the toxic fume. Some physicians even directed patients to drink mercury compounds. The side effects were horrific. Mercury poisoning causes excessive salivation, loss of teeth, neurological damage, kidney failure, and eventually death. The treatment gave rise to the phrase, "A night with Venus, a lifetime with Mercury," referring to the lifetime of mercury treatments that might follow a single night of passion resulting in syphilis. Despite its obvious toxicity, patients would experience their gums turning black, uncontrollable drooling, and tremors. Mercury remained a staple of medical treatment well into the 19th century. Ironically, some patients with syphilis who survived mercury treatments may have appeared to be cured simply because the symptoms of mercury poisoning masked the symptoms of the disease. Others may have built up immunity to syphilis over time, giving the impression that the mercury had worked. Meanwhile, countless patients suffered and died from what was supposed to be helping them. Number 8. Animal dung poultices. The filthiest bandages. Can you imagine covering an open wound with animal excrement? In medieval medicine, applying animal dung directly to wounds and infections was a common practice. Physicians would create poultices, pastes applied to the body, using fresh dung from various animals, including cows, pigs, and pigeons. These fecal poultices were believed to draw out bad humors from wounds or reduce inflammation. For example, cow dung was frequently applied to reduce swelling and treat burns, while pig dung was thought to stop bleeding. Pigeon droppings were considered especially potent and were applied to the neck to treat quinsy, a type of tonsillitis, or scrofula, a tuberculosis infection of lymph nodes. In some cases, human excrement was even used, though animal varieties were more common. The supposed healing properties of dung were taken quite seriously in medieval medical texts. Physicians classified different types of animal waste according to their perceived properties. Some were considered hot, others cold, making them appropriate for different conditions according to humoral theory. The 12th century physician Gilbertus Anglicus recommended a mixture of pigeon dung and honey for treating carbuncles, clusters of boils, while others suggested dung mixed with herbs, vinegar, or oils. From a modern perspective, the consequences of applying feces to open wounds are obvious. Severe infection. Dung contains countless bacteria, including Clostridium tetani, which causes tetanus, E. coli, and many others. Applying these directly to open wounds virtually guaranteed infection. Many patients likely developed gangrene, sepsis, or tetanus as a result of this treatment, leading to amputations or death. The practice continued for centuries, with some forms of dung poultices appearing in medical texts as late as the 17th century. Number 7. Urine therms, drinking your own medicine. Would you drink urine to cure an illness? Medieval doctors frequently prescribed urine, both human and animal, as a medicine to be consumed or applied topically. Urine was thought to have powerful healing properties and was used to treat a wide range of conditions from epilepsy to broken bones. The practice known as urine therapy or urotherapy was based on the belief that urine contained essential salts and compounds that left the body during urination. Young boys' urine was particularly prized and was collected for medicinal purposes. It was prescribed for ear infections, dropped directly into the ear canal, used as a mouthwash for gum disease, and even consumed to treat jaundice and many other internal ailments. Some physicians recommended that patients drink their first morning urine, believing it to be the most potent. Others suggested boiling urine to create concentrated urine essence for more serious conditions. Beyond drinking it, urine was used in numerous other medical applications. It was mixed with clay to create poultices for broken bones and wounds. It was used as an antiseptic wash. Ironically, fresh urine is somewhat sterile, making this one of the less harmful medieval practices. Urine was even used in eye drops for treating eye infections and vision problems, a practice that would likely cause more harm than good. The use of urine in medicine wasn't limited to human sources. Fox urine was believed to help with asthma, while cow urine was prescribed for skin conditions. One medieval recipe for treating epilepsy called for mixing a child's urine with the bile of a hare and honey, then having the patient drink this concoction for several days. While drinking urine is unlikely to provide medical benefits, it's less immediately harmful than many other medieval treatments. Urine is mostly water with waste products the body has already processed. However, relying on urine therapy rather than effective treatment would certainly allow diseases to progress unchecked. Additionally, consuming urine from others rather than one's own could transmit infections. Number 6. Theriac, the toxic cure, all containing viper flesh. Ever heard of a medicine containing dozens of ingredients, including opium, viper flesh, and ground-up mummies? Theriac was an incredibly complex and expensive medicinal compound used throughout the medieval period. Originally created as an antidote to poison in ancient Greece, it evolved into a cure-all remedy during the Middle Ages, prescribed for everything from plague to indigestion. The recipe for theriac varied over time, but typically contained between 60 and 100 ingredients. The core components included opium for pain relief, viper flesh, believed to draw out poison, honey as a preservative, and various spices and herbs like cinnamon, myrrh, and saffron. Some versions included bizarre ingredients like ground pearls, unicorn horn, usually narwhal tusk, and powdered Egyptian mummy. These ingredients would be combined and then fermented for years before use, resulting in a thick, treacle-like substance. Preparing theriac was a public spectacle in medieval cities. Apothecaries would set up in town squares to compound the medicine with the preparation, taking days and drawing crowds of onlookers. The finest theriac came from Venice, where strict regulations governed its production. Only licensed apothecaries could make it, and the process was overseen by physicians and city officials to prevent counterfeit versions. True Venetian theriac was so valuable, it was exported throughout Europe and beyond. Despite its popularity and high price, only the wealthy could afford genuine theriac. The effectiveness of this compound was questionable at best. The opium content certainly provided pain, relief, and sedation, potentially making patients feel better temporarily. However, many of the other ingredients had no medicinal value, and some were actively harmful. The long fermentation process might have produced unpredictable chemical reactions among the ingredients, potentially creating toxic compounds. Additionally, the quality control was dubious. Apothecaries often substituted cheaper ingredients when rare ones weren't available. Despite these issues, theriac remained popular well into the 17th century, with some pharmacies producing it as late as the 18th century. Its complex recipe and elaborate production gave people confidence in its efficacy, even when evidence suggested otherwise. Number 5. Corpse medicine. Cannibalism as medical treatment. Could you imagine consuming human remains to cure your illness? As shocking as it sounds, medicinal cannibalism was widely practiced throughout medieval and Renaissance Europe. The practice involved consuming or applying human body parts, blood, or bodily fluids as medical treatments. These gruesome remedies were prescribed by respected physicians and used by people from all social classes, including royalty. Human skull was one of the most common ingredients in corpse medicine. Powdered human skull, particularly from those who had died violent deaths, was believed to cure epilepsy, headaches, and neurological conditions. The powder would be mixed into drinks or foods and consumed regularly until the condition improved. Some physicians specified that the skull should come from someone who had never been buried, as the ground was thought to draw out the medicinal properties. Blood was another popular form of corpse medicine. Fresh blood from executed criminals was consumed by epileptics, who would gather at public executions with cups in hand. The warm blood was thought to carry the life force of the robust, young men who were typically executed. For those who couldn't obtain fresh blood, dried blood, or mummy was an alternative. This wasn't necessarily Egyptian mummy, but could be any preserved human remains. Human fat was widely used in ointments for joint pain and skin conditions. Executioners often supplemented their income by selling fat rendered from executed criminals. The fat would be processed and sold to apothecaries, who would incorporate it into various medicinal preparations. Human skin, bones, and even the moss that grew on unburied skulls all found their way into the medieval pharmacopoeia. The practice extended to consuming the recently deceased. In Denmark, epileptics would drink from the skulls of suicides. In Germany, hangmen sold pieces of the rope used in executions as cures for various ailments. The medicinal use of human bodies created a macabre trade, with Egyptian mummies being imported and ground up for European consumers, graves being robbed, and executions becoming medical events. This practice continued surprisingly late into history. Corpse medicine remained in pharmacopoeias into the 18th century, and some forms persisted even into the early 19th century. The consumption of human remains not only failed to cure disease, but also potentially spread infection and disease between the dead and the living. Beyond the physical risks, the psychological impact of consuming human remains, often done in desperation, must have been significant. Number 4. Lead and arsenic cosmetic, beautifying yourself to death. Would you apply known poisons to your face to look more attractive? Medieval women and men regularly used cosmetics containing lead and arsenic to achieve the fashionable pale complexion associated with nobility and wealth. These toxic beauty products slowly poisoned their users, causing a range of health problems and often leading to early death. White lead, lead carbonate, was the primary ingredient in the most popular face makeup, called syphilis. Women would apply this thick white paste to their faces, necks, and décolletage to create a stark white appearance. The application process was elaborate. The toxic paste would be spread over the face, allowed to dry, and then polished to a porcelain-like finish. Some recipes called for mixing the lead with vinegar, creating lead acetate, which is even more toxic and more easily absorbed through the skin. The effects of lead poisoning from these cosmetics were devastating but slow to develop. Users experienced headaches, nausea, and abdominal pain. Over time, more serious symptoms appeared: hair loss, tooth decay, muscle paralysis, and neurological damage. The white makeup would eventually damage the skin it was meant to beautify, causing discoloration and scarring. To cover these new imperfections, women would apply more lead makeup, creating a vicious cycle of poisoning and skin damage. Arsenic was another popular ingredient in beauty products. Arsenic wafers were consumed to lighten the complexion from within, while arsenic-based creams were applied topically. Women also use arsenic to remove unwanted hair, creating depilatory creams that burned away hair along with layers of skin. The arsenic would be absorbed into the bloodstream, causing symptoms similar to lead poisoning, but often more acute, including vomiting, diarrhea, and in high enough doses, death. These toxic cosmetics weren't limited to the medieval period, but continued well into the 18th and 19th centuries. Queen Elizabeth I was famous for her white, mask-like makeup which contained lead and may have contributed to her death. Despite growing awareness of their dangers, these products remained popular because they were effective at creating the desired appearance. The beauty standard of a pale complexion was so strong that women and men were willing to risk their health and lives to achieve it. The social pressure to use these toxic products was immense. Pale skin signified nobility and wealth, showing that one didn't need to work outdoors. In a society where social standing was paramount, the immediate benefits of looking aristocratic outweighed the long-term health consequences that weren't fully understood at the time. The true irony is that while these products created a youthful appearance in the short term, they accelerated aging and caused premature death in their users. Number 3. Tobacco smoke enemas. Blowing smoke where the sun doesn't shine. Can you believe doctors once pumped tobacco smoke into people's rectums as a medical treatment? While primarily an 18th century practice, tobacco enemas have their roots in Native American medicine that Europeans adapted after tobacco was introduced to Europe in the 16th century. The practice became so common that special bellows were designed specifically for the purpose of administering these smoke enemas. The tobacco smoke enema was initially used primarily for resuscitating drowning victims. The theory was that the warmth of the smoke and the stimulating properties of nicotine would revive the drowned person by warming them internally and stimulating respiration. Tobacco smoke enemas were considered so effective for reviving drowning victims that the equipment for administering them was reportedly hung alongside the River Thames in London, much like modern life preservers. Over time, the use of tobacco enemas expanded to treat a wide variety of conditions. They were administered to patients suffering from cholera, intestinal pain, typhoid fever, headaches, abdominal cramps, and even the common cold. The procedure involved inserting a tube into the rectum and using special bellows to pump the smoke inside. In some cases, a more direct approach was used, with a practitioner actually blowing the smoke through a tube. From a modern perspective, this treatment was not just ineffective, but potentially harmful. Nicotine is toxic when absorbed in large quantities, and introducing it directly into the colon allows for rapid absorption into the bloodstream. Patients may have experienced nicotine poisoning with symptoms including nausea, vomiting, increased heart rate, and in severe cases, seizures or respiratory failure. Additionally, the hot smoke could cause burns to the sensitive rectal tissues. The practice began to decline in the early 19th century after research showed that nicotine could actually stop the heart rather than stimulate it. This led to the English phrase, to blow smoke up one's ass, meaning to flatter someone with empty compliments, a reference to this outdated and ineffective medical treatment that did more harm than good. Number 2. Children's teeth transplants. The creepiest dental work. Would you wear someone else's teeth? In the medieval and early modern periods, tooth transplantation involved extracting teeth from one person, usually a poor child or corpse, and implanting them into the mouth of a wealthier recipient. This gruesome practice was considered cutting-edge dental technology and was performed on aristocrats and wealthy merchants willing to pay for a new smile. The procedure was painful and barbaric, by modern standards. The recipient would have their diseased tooth extracted, often without anesthesia, beyond alcohol or opium. Immediately afterward, a tooth taken from a donor would be forced into the bloody socket. Sometimes the new tooth would be tied to adjacent teeth with silk threads or fine gold wire until it took hold. The theory was that the tooth would fuse with the recipient's jawbone and function like a natural tooth. Finding donors for these transplants created a gruesome marketplace. Poor children would sell their healthy teeth for money, sometimes being forced into this trade by parents or guardians. Grave robbers would extract teeth from fresh corpses, particularly those of young people, to sell to dentists. Resurrectionists, specialized in obtaining corpses for medical studies, would often remove and sell the teeth separately, as they fetched a good price. Battle sites became hunting grounds for teeth after conflicts with scavengers, collecting teeth from dead soldiers. The success rate for tooth transplantation was incredibly low. Without understanding tissue, rejection, or proper sterilization, most transplanted teeth failed to integrate with the recipient's jaw. Infection was common, sometimes spreading throughout the mouth, and occasionally leading to death from sepsis. There were also documented cases of disease transmission, particularly syphilis, from donor to recipient through the transplanted teeth. Despite these risks and high failure rates, tooth transplantation remained popular among the wealthy from the late medieval period through the 18th century. The practice began to decline only with the development of better denture technology and increased understanding of disease transmission and tissue rejection. Even as it fell out of favor, the practice highlighted the enormous dental health disparity between the wealthy and the poor. The latter could be literally stripped of their healthy teeth to serve the vanity of the rich. Number 1. 4 thieves vinegar. Drinking vinegar to prevent plague. Have you ever swigged vinegar infused with herbs to ward off deadly disease? Medieval and Renaissance Europeans did exactly that during plague outbreaks. 4 thieves vinegar, as it was commonly known, was a concoction of vinegar infused with herbs, spices, and sometimes garlic that was believed to prevent the bubonic plague. People would drink it, wash with it, and even soak their clothes in it as protection against the dreaded Black Death. The origin story of this remedy is as fascinating as the concoction itself. According to legend, during a plague outbreak in Marseille, France, variously dated to the 14th or 17th century, 4 thieves were caught robbing the homes and bodies of plague victims. When brought before the judges, they were offered leniency if they revealed how they had avoided contracting the plague while touching infected bodies. The thieves supposedly disclosed their secret preventative, a special vinegar infused with protective herbs that they drank and used to wash their bodies. The recipe for 4 thieves vinegar varied widely, but common ingredients included wormwood, meadowsweet, juniper, sage, cloves, garlic, and rosemary steeped in wine vinegar. Some versions added camphor or angelica root, while others included lavender or rue. These herbs would be macerated in vinegar for several days or weeks before the mixture was strained and used. Wealthier individuals might add rare spices, like cinnamon or nutmeg, to their personal formulas. The use of this vinegar was extensive during plague times. People would carry vinegar-soaked sponges to sniff when walking through cities. They would wash their hands and faces with the vinegar multiple times daily. Some would soak their clothes in diluted versions of the mixture before wearing them. Others would drink small amounts of the vinegar daily as a preventative. Plague doctors famously filled the beaks of their bird-like masks with herbs and vinegar-soaked cloths, believing this would purify the miasma, or bad air that was thought to transmit disease. Did it work? In some limited ways, possibly. the strong smell might have kept people at a distance, reducing person-to-person transmission. Some of the herbs used do have mild antibacterial properties, and vinegar itself is acidic enough to kill some germs on surfaces. However, it certainly wasn't effective against the Yersinia pestis bacterium that causes plague, nor against the fleas that transmitted it. People who relied solely on Four Thieves vinegar for protection would have remained just as vulnerable to plague as their neighbors. The potential harm came not from the vinegar itself, which was relatively benign compared to other medieval remedies, but from the false sense of security it provided. People believing themselves protected might have taken fewer effective precautions, such as avoiding plague-stricken areas altogether. Additionally, drinking large quantities of herb-infused vinegar could cause digestive upset, erosion of tooth enamel, and irritation of the digestive tract. What would you have done if you lived in medieval times and got sick? Would you have trusted these bizarre remedies, or taken your chances with the illness itself? Looking at these strange and often dangerous treatments from our modern perspective, it's easy to feel superior. But these were the cutting-edge medical interventions of their time, prescribed by the most educated physicians available. Perhaps in 500 years, future generations will look back at our medical practices with similar horror. After all, who knows what current cures might eventually prove to be doing more harm than good?